the universe expands. And so does the frontier of knowledge. As humanity conquers galaxies, a new generation of nurses steps forward to shape the future.
Mission 724A, this is Control. Prepare for immediate medbay deployment. Critical case study scenario initiated. Over.
Roger, Control. Echo 1 to medbay, standing by for details. Over.
Echo 1, patient status shows rapidly declining vitals. You have 3 minutes for intervention. Case study question. Massive trauma in zero gravity. Prioritize actions. Over.
Echo 1, patient status shows rapidly declining vitals. You have 3 minutes for intervention. Case study question. Massive trauma in zero gravity. Prioritize actions. Over.
Echo 1, vitals are dropping fast. I recommend immediate fluid resuscitation and airway management. Over.
Agreed, Delta 2. Initiating intervention. Stay focused. This is what we trained for. Over.
Echo 1, time remaining. 90 seconds. NCLEX study update. Next question incoming. Over.
Every decision is a step closer. Every answer defines your future. Are you ready to lead? In the year 2167, aboard the interstellar medical ship Pulse Voyager, a 65-year-old space colonist from Mars presents with severe chest pain during a planetary exploration mission. The advanced AI medical assistant detects signs of myocardial ischemia after analyzing the patient's biofeedback system. As the nurse, you must manage the patient's condition using space-age technologies and treatment protocols. Select the appropriate nursing interventions for managing coronary artery disease CAD in this futuristic setting, based on the drop-down options provided in the table below. In the future, fast-acting nanobots can be injected to regulate blood pressure instantly, reducing the myocardial workload more efficiently than current for medications. High cholesterol in the space age can be treated by nanodrones, which target and break down cholesterol deposits in the arteries, preventing further buildup and heart strain. In cryosleep, regular medications can't be used. Cryosafe oxygen therapy ensures oxygen delivery to the tissues while the patient remains in a suspended state, reducing ischemic damage. Elevated troponin levels indicate myocardial damage. Clot-dissolving nanobots can be deployed to dissolve any thrombus quickly, restoring blood flow to the affected area of the heart. In anti-gravity environments, oxygen levels and distribution can be compromised. Administering ionized oxygen helps enhance oxygen absorption in low-gravity conditions, preventing further complications like hypoxia. A 58-year-old astronaut who has been stationed in zero gravity for 18 months experiences episodes of dizziness, fatigue, and chest tightness. The biomonitoring system detects irregular heart rhythms, and lab results show increased lipid levels. As the nurse on this intergalactic mission, you are tasked with managing and preventing the progression of coronary artery disease CAD using advanced space-age treatments. Select the appropriate nursing interventions based on the drop-down menu options. In space, irregular rhythms can be corrected more precisely with nanobots designed to repair and stabilize electrical activity in the heart without needing traditional medications. Nanoinjectors are programmed to target and dissolve excess lipids in the bloodstream, preventing the formation of arterial plaques and reducing the risk of coronary artery disease. Spacewalks put stress on the cardiovascular system. Delivering ionized oxygen directly through a nanocannula ensures rapid oxygen delivery to tissues, compensating for the lower gravity environment and reducing hypoxia. In the space-age setting, next-gen statins can be infused and controlled by AI systems to reduce LDL cholesterol levels more efficiently, adjusting dosage based on real-time lipid monitoring. The Saint segment depression indicates myocardial ischemia. A thrombolytic gel patch quickly dissolves blood clots, restoring blood flow to the heart muscle and preventing further ischemia in a zero-gravity environment. While aboard the deep space cruiser Stellar Explorer on a 5-year mission to the outer solar system, a 62-year-old commander with a history of hypertension and smoking experiences intermittent chest pain during hyper-sleep recovery. The onboard medical AI detects ischemic changes, and the nurse must use advanced space-age interventions to manage his condition. Select the appropriate interventions and actions based on the clinical findings provided. Elevated blood pressure during hypersleep recovery can place extra strain on the heart. Eye-controlled vasodilators quickly reduce blood pressure by dilating the blood vessels, improving blood flow. Saint segment elevation indicates myocardial infarction. Deploying cardiac nanobots to remove any obstructing clots restores blood flow to the affected area of the heart without invasive procedures. Elevated LDL cholesterol in a space environment poses a long-term risk of atherosclerosis. NAI-controlled LDL reducing infusion targets the cholesterol molecules, breaking them down more efficiently. Nitroglycerin reduces chest pain by dilating the coronary arteries, improving blood flow to the heart muscle. In space, fast-acting versions of the medication are vital for quick intervention during chest pain. Dizziness and cold sweat are signs of ischemia and hypoxia. Administering ionized hyperoxygen via nanocannula delivers oxygen rapidly, improving cellular oxygenation in critical situations.